Hello everyone, welcome back to Lifestyle Medicine and Metabolic Diseases Discussions. Today we will discuss a recent paper published by Sevilla Gonzalez, Metabolomic Markers of Glucose Regulation After a Lifestyle Intervention in Prediabetes. What is already known on this topic? Lifestyle interventions provide benefits to glucose regulation in prediabetes. There is a considerable variation in the individuals to receive the benefits of a lifestyle interventions. Metabolomics provides substantial insights into the interplay between disease and environmental exposures to explain individual responses to treatment. What this study adds: 3 metabolites were significantly associated with regression to normoglycemia in prediabetes: N-acetyl D-galactosamine, putrescine, and 7-methylguanine. In addition, changes in taurine and hypotaurine metabolism pathways were observed after a lifestyle interventions. The metabolomic changes associated with a lifestyle intervention are compatible with biomarkers of protein consumption, lower red meat and animal fats, and higher seafood and vegetables. How this study might affect research, practice, or policy. Metabolites associated with regression to normoglycemia can provide a potential route for therapeutic target discovery. Food profiles illuminated from these results can help to design more effective therapeutic strategies for diabetes prevention. Diabetes is a huge problem across the world. The type that usually occurs can depend on your ethnic background, which makes it unpredictable and difficult to control. There is a pre-diabetes diagnosis that any individual with high blood sugar levels can get. You don't have to be overweight or obese, and your body doesn't even need to be producing an excess of insulin. But if your blood glucose level is above normal, you could qualify for this condition. Individuals with prediabetes are at a higher risk of developing type 2 diabetes and cardiovascular disorders. Prediabetes is often a reversible illness. In fact, among those with prediabetes, the vast majority return to healthy blood sugar levels and avoid developing diabetes. Lifestyle interventions are now widely recognized as being an excellent way of preventing type 2 diabetes. However, people who are at high risk for the disease vary in their responses to lifestyle changes, so some might see a benefit and others won't. High-throughput metabolomics technologies are great for providing insights into the pathophysiological pathways and understanding insulin resistance, prediabetes, and other pathologies. They also reveal dietary habits that can be analyzed to provide a comprehensive metabolic map that can help you better manage your diet. There is evidence of differences in the lipidomic profile of high-density lipoprotein and low-density lipoprotein particles of people who have prediabetes, but then return to normal blood glucose levels 2 years after they stop having treatment. It is unclear how the changes we see in blood metabolites are related to our lifestyles. Metabotypes are used to group individuals based on their phenotypic or metabolomic profiles and analyze the responses of these groups to dieting and weight loss. Identifying the metabolomic profile of individuals with prediabetes who regress to normoglycemia can provide substantial insights into the dietetic and physiological modulators of glucose regulation during a lifestyle intervention that could be nutritional intervention targets for type 2 diabetes prevention. This study aimed to identify metabolomic markers of regression to normoglycemia in the context of lifestyle interventions in individuals with prediabetes. Study population and design. The researcher conducted a single-arm intervention study with 24 weeks of follow-up. Eligibility for study participation was determined by the presence of at least one prediabetes criteria according to the American Diabetes Association: fasting glucose between 100 and 125 milligrams, hemoglobin A1C 6.5%, and a 2-hour blood sugar between 140 and 199 milligrams after an oral load of 75 grams of glucose. Additional criteria were age between 18 and 69 years and body mass index in the overweight or obesity categories. Exclusion criteria included using glucose-lowering drugs such as metformin or corticosteroids, pregnancy, and subjects under nutritional or physical activity counseling prescribed by a medical professional. Let's see the results. Intervention effectiveness. After 24 weeks of lifestyle interventions, the mean weight loss was 2.5 to 3.5 kilograms, with 48% of the subjects reaching the greater than 3% weight loss goal. The intervention was effective in reducing weight, waist circumference, body fat, fasting glucose, HbA1c, and increasing insulin sensitivity measured by p-value. Participants displayed favorable changes in their dietary behavior, significant reduction in total energy and sugar intake, and increased protein intake. Q lesser than 0.01. The increment of protein consumption was associated with a lower probability of maintenance HRCI independent of age, sex, HbA1c at baseline, and weight loss. Increased protein consumption increased after the intermediate visit. Metabolites associated with regression to normal glucose regulation. Before the intervention, 3 metabolites were selected at least 10 times in the least absolute shrinkage and selection operator penalized regressions. After 6 months of intervention, 40 metabolites measured by their fold changes were prioritized 10 or more times in the least absolute shrinkage and selection operator penalized regressions. The profile was composed mainly of changes in amino acids and organic compounds. This profile displays metabolites biomarkers of vegetables, fruits, and legumes, as well as sources of protein and fat such as amino acid, fatty acid, acylcarnitines, and glycerophospholipid. After adjusting for HbA1c and weight loss, only 3 metabolites remained significant: N-acetyl D-galactosamine, 7-methylguanine, and putrescine. Metabolomic changes after lifestyle intervention. Finally, the researchers sought to identify metabolites with substantial change after the lifestyle intervention. 14 metabolites displayed significant changes before and after lifestyle intervention with fold change greater than 0.25 and Q lesser than 0.05. After the lifestyle intervention, the researcher observed lower levels of C14 carnitine fold change 0.46 and Q equals 0.013. The sample also displayed increased levels of cysteine, hypotaurine, sphingosine, taurine, 5-hydroxytryptophan, serotonin, glycine. Genetics, genomes, proteomics, metabolomics, and proglycine are shown in Figure 3a. These metabolites enrich the taurine and hypotaurine metabolism pathway shown in Figure 3b. The metabolomic profile after lifestyle intervention reflects activity in biomarkers of protein consumption, lower red meat and animal fats, and higher seafood and vegetables. Discussion. This study set out with the aim of identifying metabolomic markers of regression to normoglycemia in the context of 24 weeks of lifestyle intervention in individuals with prediabetes. Changes in 3 metabolites were significantly associated with regression to normoglycemia independent of other treatment factors such as HbA1c at baseline and weight loss. In addition, the metabolomic changes associated with lifestyle interventions were represented by activity in biomarkers of protein consumption, lower red meat and animal fats, and higher seafood and vegetables. These metabolites enrich the taurine and hypotaurine metabolism pathways. In this study, low concentrations of N-acetyl D-galactosamine were associated with a higher probability to regress to normoglycemia. This is consistent with previous reports that associate higher concentrations of N-acetyl D-galactosamine with incident cardiovascular disease, diabetes mellitus, as well as the longitudinal risk of all-cause, cardiovascular, and cancer mortality after years among initially healthy individuals. A large proportion of the potential risk associated with elevated N-acetyl D-galactosamine would relate to systemic inflammatory pathways. Further studies are needed to explore potential modulators and causes of N-acetyl D-galactosamine concentrations. Low levels of putrescine were associated with a higher probability of regression to normoglycemia in this study. Putrescine is a polyamine. In mouse models, the dysregulation of polyamine metabolism impacts glucose, lipid, and energy homeostasis. Conclusion. The evidence from this study suggests that changes in 3 metabolites, N-acetyl D-galactosamine, putrescine, and 7-methylguanine, were significantly associated with regression to normoglycemia independent of other treatment factors such as HbA1c at baseline and weight loss. In addition, these results show that increased protein consumption could positively impact the treatment of individuals with prediabetes. The findings of this study have several practical implications for treating individuals at high risk of type 2 diabetes.